Basically, it starts from the idea that the quantification of wellness is something that is a big opportunity. Even in the consumer front, we see more and more tools and devices available that enable pretty much anybody to track different things, from their activity to their sleep, to their nutrition, all the way to their genetics. That opens up a lot of opportunities in terms of creating lifestyle interventions that are very tailored, personalized to the individual, as opposed to just a one-size-fits-all solution. In the same way that we today personalize pretty much a lot of services around us, like advertising, retail, entertainment. So today we can also use someone's data in order to make to personalize the intervention, the lifestyle intervention, and hopefully get better outcomes. The problem facing this opportunity is that it is still very difficult to implement for many reasons. One of them is the technology, is because oftentimes the data comes from multiple sources. So if you're a consumer or a patient, it's very hard, or even professional, it's very hard for you to get a comprehensive view of your data, of your wellness data, because some of it might be coming from a device, some of it might be coming from something in your home, some of it might be just self-reported that you would need to track. So it's just too much technology and too much work involved in it. And so that's one of the barriers. And the other one is that sometimes the use case is not very clear for you, because at the beginning you don't really know what insights you're going to extract from that data. The solution actually that we offer through my organization, for instance, Fitnescity, is to basically make that simple. So, for example, on a technology front is by aggregating the data, and also most importantly, from multiple sources, but most importantly, make sense of it. So rely on things like visual analytics to make sense of the data, so that it's not just gathered, but it also serves as a way to make better decisions, whether you're a professional or a consumer. Part of the solution is that we like to insist on is that it's not just about technology. Obviously, it's a big component of it, but there's also the human part, the human connection part, and the behavioral design part. So in summary, yes, the opportunity is big. It's just that we have to overcome some of the challenges, technological, but also human challenges in implementing it. But I really think, that it's big, because if you look at today, the health system, big part of the conditions and the cost actually that we see is due to conditions that are largely preventable through lifestyle changes, like type 2 diabetes or heart disease. And so if we take that wellness and prevention aspect and we sort of improve it or optimize it to make it more tailored to each individual, I think that could open up a lot of opportunities. I really think that wellness or prevention will be a very, very big industry. And I think that the biggest companies of tomorrow are going to be not necessarily 10 years maybe down the road, not necessarily pharma, but mostly wellness companies, technology-enabled wellness companies, as we start to realize that there's a lot of potential in improving people's life and improving health just by prevention, and as we improve the way we do it.